Dr. Heather here, Vibrant Health and Wellness, and I want to talk to you today about pain, and specifically neck pain, because right now when things are potentially a little more stressful, pain that is in the neck can often get exaggerated, or we can potentially not have pain to begin with, and then we develop pain when we're under more stress. So I want to go through just a few potential tips and tricks that may help you to alleviate your own neck pain. And the reason for this is because I have had severe neck pain in my past, in fact about 2 decades worth, and it wasn't until I started mastering some foundational steps for myself to really gain some self-awareness that I was able to take control of my pain and not let my pain control me. Briefly here, I would get a lot of pain at the top part of my neck, underneath the skull. Those first 2 vertebrae would often rotate, and that would cause a lot of pain. When those first 2 vertebrae, out of the 7 total cervical vertebrae, when the first 2 start to move into a off-axis position, if you will, not fully in a good neutral position, then it can cause a lot of issues, and particularly it can also develop into headaches. As we start to get pain from the nerve up into the head, and in my case, I would also get a lot of pain into my left eye with ocular migraine, and it feels like there's a sharp stabbing, like ice pick, like in the back of your eye, and that was just completely debilitating. It was so horrible. So I was just so determined to keep working and finding different ways of helping to alleviate it, and not only just alleviate it, but to help it not come back, or at least really reduce the incident of it coming back. And so I'm happy that now I can rarely have issues with it, and if I do, I can often correct it myself, or if I need to, I get a little bit of help, but it's nowhere near the severity that it used to be. So let's move into what you can start to be aware of, because again, when you have some self-awareness of how you can work some things in your body, then these are the foundational steps. And even though some things may seem kind of simple, it's the simple things that lay the foundation, and sometimes those simple things can be a huge improvement, whether it's for pain, whether it's for increasing function, just helping to get your life back to where you want it to be. And it also helps, again, to maintain things so that it doesn't get back into a bad place. Because if we don't have the foundational parts of this in a good way, then there's nothing to come back on. Like, you might feel good and now pain after some kind of technique or some treatment, but if you're constantly coming back into this cycle, it's often because some of the foundational things aren't there. So we're going to start with some of the simple things and then move from there, moving up. So let's go ahead and get talking about all of this. Of course, I do need to mention that it's always best to have a healthcare medical professional evaluate you as well before you're necessarily doing a lot of these things. But if we're just talking about some general things to be aware of with your neck, these are some easy, simple tips to start with. So let's start with breathing. A lot of times with neck pain, we get into this tendency of breathing with our upper chest and our neck. And instead, we want to be breathing with our diaphragm. So our diaphragm is living underneath our sternum and along kind of through this area and by the rib cage. And what we want to have happen with our good diaphragm breathing, or basically belly breathing, is to have that diaphragm and that rib cage is going to be coming out, like in the front, and out towards the side, maybe a little bit towards the back. So we're going to have basically a 360-degree type of breathing. When we're doing that, then we help to get the breathing pattern correct, and we get some load, stress off of the neck. When we're in a stressful state or some type of negative emotion, or we're just in a big hurry, a lot of times these scaling muscles that come and attach to the edge of your vertebrae here and then down underneath your collarbone into your ribs here, they start to work to lift like this, your chest up, and then you start to breathe with these accessory muscles. And then you're doing the job, but they're not meant to do it 24/7. We need the huge big diaphragm to do that instead. So that's the first tip, is just being aware of how you are breathing and simply putting a hand here and then a hand down on, like here on your diaphragm, and observe where you're breathing from, and then see if you can make that correction to let the bottom hand do the breathing for you and not this. Because it's amazing how much we get into this tendency up here and we may not even realize it, whether it's severe or mild amount. Okay, next easy tip is going to be looking at stretching. And the first area I want to look at stretching is actually through the chest, because we use our chest muscles all day long. We're constantly here at our computer, we're reaching, we're moving things in front of us. So there's a natural tendency for these bigger muscles to get tight, especially if we're not in a regular routine of helping to stretch them out. So when we want to look at stretching these muscles, we can just simply have our arm back and like into a doorway and just stepping into this positioning, coming forward. In fact, I can get a little bit of a stretch already just by moving my body here and keeping my hands this way, and getting that stretch into this section. You can get a little different stretch for another pec muscle, the pec minor, by coming up here and then coming forward. You won't get as much movement out of it, just because of some of the anatomical positioning, but also because that one can get quite tight. So when these are tight, what they're doing is they're pulling your shoulder forward, and if our shoulders start to roll forward, what will happen is these muscles on the back, this trapezius muscle coming up and attaching to the base of your skull, it gets really tight, along with the levator scapulae muscle. And they get really tight because they are trying to hold our bowling ball of a head, right, like 14 pounds, 15-pound bowling ball of a head, from not falling forward. So if we're tight here, this is putting an odd type of stretch, like an eccentric type of stretch, which is hard for a muscle, pulling it forward. And then if we're doing computer work or something else, or just have poor posture and our head is coming forward, then that is another tremendous amount of strain here. So you can kind of get an idea of how this muscle is going to be so overloaded by holding our bowling ball of the head clear out here all the time. So stretching here, 15, 30 seconds, easy stretching. Nothing severe, just let it be as natural and a stretching discomfort, not pain. And then posture. So again, if we're going to be in this position, that's constantly putting a strain back here. These muscles are intended to hold our body in a position where it's not in neutral. We want, right, our head ideally over our shoulders over our hips over our ankles, and then things should be able to rest and relax into that position versus being strained into this type of position all the time. Okay, so those are a couple basic things. Let me touch a little bit though on some of these muscles in here that you can work on stretching. So these scalene muscles, if you're just gently bringing your ear to your shoulder and maybe a little bit of overpressure, a little bit of assistance with your hand here, and changing neck position, chin position, you can start see them here. You can start to get these a little bit of a stretch. Again, easy does it, 15, 20 seconds, maybe 30 seconds is sufficient. And part of this is just kind of playing with, okay, where does that feel like it needs to get stretched? A little bit this way, a little bit forward, a little bit here to get more along the back, and to get some of these muscles to start to release. I also like to take the chin and then position it at this angle to get the muscles along the back where it's coming from the neck and then coming into the top of that shoulder blade to that levator muscle. So chest stretching, a couple neck stretches there, posture and breathing. And then if it needs to get more specific than that, that's where we want to look into definitely having an evaluation and seeing what's going on with the specific vertebrae, what's going on with the skull positioning, what's going on with the first rib positioning. I have a video on that if you want to look that up if you're having a lot of centered pain around this area, because it may not just be muscle, it might be a rib that's in elevated too high of a position that needs a little assistance. So you can look that video up. But yeah, these are just some basic things that can give a lot of relief. If you want to put a little bit of a heat pack on beforehand, or like a nice shower, get things warmed up, and then work through some of these ideas, that will get you started. So the last thing I want to mention on is sometimes we have a chronic condition with the neck, and maybe you've gone through some different treatments already. Maybe things really aren't getting improved, or they get improved but then they plateau, they don't get any better, and then they get worse again. Sometimes that's because there's other things at play, and meaning that systemically through your whole body there may be a trigger of inflammation that's keeping this neck mad and inflamed and tight, and that can include the muscles or the nerves or other structures in that area. And so I work with people in those cases where they're not getting the relief that they want, they're not getting back to the life that they want to live, with combining any physical therapy then with functional medicine, if we need to move into that side. So functional medicine, physical therapy. And then we get detailed into looking at what are the root triggers for that inflammation and pain in your body. And that can come from a lot of different sources. But I just want to mention that there's certainly other things that can be explored, and I'm happy to help you with this. You're welcome to look on my website, www.vibranthealthwellness.org, and research a little bit more, and feel free to reach out to me, and I'm happy to talk to you for 15-20 minutes just to see what's going on, and if there's things that I can assist you with. So, okay, I hope this is helpful, and have a good day.